Something big just happened in Washington, and if you're over 50, you need to hear this before it gets buried in the news cycle. The United States Senate just passed a major elder care bill. And I know, you've heard politicians make promises before. You've seen bills come and go. But this one is different. This one has real teeth, real money behind it, and real consequences for millions of Americans who are already living on fixed incomes, dealing with Medicare confusion, and trying to figure out how to make their Social Security stretch just a little further each month. So today, we're going to break down exactly what this bill says, what it means for you personally, and what you need to do or stop doing right now. Because here's the thing. When a bill like this passes, most people don't find out about the changes until it's too late. They miss deadlines. They forget to enroll in new programs. They keep paying for things they no longer need to pay for. Or worse, they lose benefits they didn't even know they qualified for in the first place. That is not going to happen to you. Not today. Let's start with the big picture so you understand what we're actually dealing with. The Elder Care Act, which has been working its way through Congress for over 2 years now, was passed by the Senate with strong bipartisan support. That means both Republicans and Democrats voted for it. And when that happens, when both sides actually agree on something, you know it's serious. This isn't political theater. This is legislation that is headed toward becoming the law of the land, and it touches almost every major program that seniors depend on. We're talking about Social Security, Medicare, Medicaid, prescription drug coverage, home care services, nursing home regulations, and a handful of financial protections that have been desperately needed for a long time. Now, the bill still needs to go through the House and be signed by the President before it's fully enacted. But given the bipartisan momentum, experts are saying it's likely to move fast, which means the clock is already ticking. So let's get into the details, because this is where it gets really important. One of the biggest provisions in this bill has to do with Social Security cost of living adjustments, what most people call COLA. Right now, the way COLA is calculated is based on something called the CPIW, which stands for Consumer Price Index for Urban Wage Earners. The problem? That index tracks the spending habits of younger working-age people. It doesn't accurately reflect what seniors actually spend money on, things like healthcare, prescription drugs, and housing. The Elder Care Act proposes switching the calculation to something called CPIE, the Consumer Price Index for the elderly. This has been a demand from senior advocacy groups for decades, and it finally has a real shot at happening. What does that mean for your check? If the CPIE had been used over the last 10 years, studies suggest that the average Social Security recipient would have received somewhere between $1,400 and $1,800 more per year. Every year. That's money that should have been in your pocket. And wasn't. But here's the problem. Even if this change passes, it won't be retroactive. You won't get back pay for past years. That ship has sailed. What matters now is that going forward, your annual increases could be more accurately tied to what you actually spend. That's a real meaningful change. But only if you know about it and stay enrolled and active in your benefits. Now let's talk about Medicare, because this is where things get serious for a lot of people. The bill includes a provision called the Senior Access Expansion Act, which is tucked inside the larger Elder Care Bill. This provision would expand Medicare coverage in ways that haven't happened since the program was first created in 1965. First, hearing. Right now, traditional Medicare does not cover hearing aids. Do you know how much hearing aids cost out of pocket? We're talking anywhere from $2,000 to $7,000 per pair. And most seniors need them replaced every 3 to 5 years. The Elder Care Bill would require Medicare to cover hearing aids and related services, including fittings and follow-up care. For the roughly 48 million Americans over 60 who experience some degree of hearing loss, this is enormous. Second, dental. Traditional Medicare doesn't cover routine dental care either. No cleanings, no fillings, no dentures, nothing. And dental problems in seniors don't just affect your smile. They're linked to serious health conditions like heart disease, diabetes complications, and even cognitive decline. The bill would create a basic dental benefit under Medicare, covering preventive care and some restorative procedures. Not everything, but a significant start. And third, vision. Eye exams, glasses, and treatment for conditions like glaucoma and macular degeneration are largely out of pocket for most Medicare beneficiaries right now. The bill would change that. Most people don't realize this, but the out-of-pocket costs for hearing, dental, and vision services are one of the top reasons seniors drain their savings prematurely. One bad year, a tooth infection that requires extraction and a partial denture, plus a new pair of hearing aids. And you could be looking at $10,000 or more out of pocket, just like that. If this bill passes and these provisions take effect, that financial burden could be dramatically reduced for millions of people. But here's the catch, and there's always a catch. New Medicare benefits don't enroll you automatically. You will need to take action. You may need to update your coverage plan. You may need to switch providers. And if you're on a Medicare Advantage plan instead of traditional Medicare, the rules could be different for you entirely. More on that in just a moment. Before we keep going, if this information is helpful to you, please take a second and hit that like button. It tells us that this kind of content matters to you, and it helps us reach more seniors who need to hear this. And if you haven't subscribed yet, please do that right now. We cover Social Security updates, Medicare changes, and legal rights for seniors every single week, and I don't want you to miss a thing. Okay, let's keep going. Now, about Medicare Advantage plans. This is something that doesn't get nearly enough attention, and it needs to. If you're currently enrolled in a Medicare Advantage plan, sometimes called Part C, you need to pay very close attention to the next few months. The Elder Care Bill includes new oversight and transparency requirements for Medicare Advantage insurers. Why? Because there have been widespread complaints, and in some cases, federal investigations, into insurance companies denying claims that traditional Medicare would have approved, using prior authorization delays to prevent or postpone care, and marketing their plans in misleading ways. The bill would require Medicare Advantage plans to publicly report their denial rates. It would limit the use of prior authorization for essential services like chemotherapy, dialysis, and emergency care. And it would create a faster appeals process so that if your claim is denied, you're not waiting months to fight it. This is where I want you to think about your own situation right now. Have you ever had a claim denied by your Medicare Advantage plan? Have you ever been told you needed prior authorization for something your doctor said was urgent? You're not alone. And this legislation is a direct response to those stories. But here's what you need to do right now, regardless of whether this bill becomes law. Pull out your Medicare Advantage plan documents. Look at your denial rate history if you can access it. And if you've had a claim denied in the last 12 months that you believe should have been covered, you may still be within your window to file a formal appeal. Don't let that deadline pass. Now, let's shift to something that affects a slightly different group but is just as critical. The Elder Care Bill also contains major provisions related to long-term care, nursing homes, assisted living facilities, and home-based care services. And this is an area where we are seeing a genuine crisis in America right now. Here's a number that might stop you cold. The average cost of a private room in a nursing home in the United States is now over $108,000 per year. A shared room runs about $94,000. Assisted living averages around $54,000 annually. And most of it, is not covered by Medicare unless you've had a qualifying hospital stay and meet very specific conditions. That means the financial burden falls on the individual and their family. And when savings run out, many people are forced to spend down their assets to qualify for Medicaid. It's a process that can be devastating, humiliating, and completely avoidable with the right planning. The Elder Care Bill addresses this in two ways. First, it expands Medicaid home and community-based services, meaning more funding to help seniors stay in their own homes rather than being placed in facilities. This is huge. Most seniors want to age at home. Most families prefer it. And research consistently shows that home-based care is both more dignified and more cost-effective. The bill would require states to expand their home care programs and reduce waiting lists, which in some states can stretch for years. Second, the bill introduces stronger regulations and staffing requirements for nursing homes. This directly responds to the problems exposed during and after the COVID-19 pandemic, when understaffed facilities led to catastrophic outcomes. Under the new requirements, nursing homes would need to maintain minimum nurse-to-resident ratios, conduct more frequent inspections, and make their quality ratings more transparent to the public and to families. What happens next might surprise you. Some nursing home industry groups are already fighting this bill. They're lobbying against the staffing requirements, claiming they can't afford them. And while there's genuine debate about implementation costs, the question you have to ask yourself is this: would you rather your loved one be in a facility with adequate staff or not? This is personal for so many families. And if you have a parent, a spouse, or even yourself potentially facing a nursing home stay in the future, you need to understand your rights under current law, and you need to know how these new protections could change what you're entitled to. One thing you can do right now before this bill even passes: go to Medicare's Nursing Home Compare tool at medicare.gov. You can look up any facility by name or zip code and see their staffing levels, inspection results, and quality ratings. Don't wait for a crisis to do this research. Do it now, while you have time. Let's talk about something else in this bill that most people are completely overlooking, and that's elder financial abuse protection. According to the FBI and the Consumer Financial Protection Bureau, seniors in the United States lose an estimated $28 billion per year to financial scams and exploitation. That's not a typo. $28 billion every year. And it's not just strangers calling with Medicare scam offers or fake IRS threats, although those are very real. A significant portion of elder financial abuse comes from people the victim knows personally: family members, caregivers, people in positions of trust. The Elder Care Bill would establish a new federal framework for reporting and prosecuting elder financial abuse. It would require financial institutions, banks, credit unions, investment firms, to train their employees to recognize and report signs of elder financial exploitation. It would create a streamlined federal reporting system so that suspected abuse is flagged and investigated more quickly. And it would establish restitution pathways so that victims have a better chance of actually recovering stolen funds. This is where things get serious, because financial abuse doesn't just steal money. It destroys retirement security. It forces people to delay care. It causes depression, anxiety, and shame. And in many cases, victims don't report it because they're embarrassed, or because the abuser is a family member, or because they simply don't know where to turn. If you or someone you love has been the victim of financial scams or exploitation, there are resources available right now. The National Elder Fraud Hotline is 1-833-FRAUD-11, and your state attorney general's office almost certainly has a senior protection unit. Don't suffer in silence. Now, let's talk about prescription drugs, because this is something I know is on a lot of people's minds. The Inflation Reduction Act, passed a couple of years ago, already made some changes to prescription drug pricing, including a $2,000 annual cap on out-of-pocket drug costs under Medicare Part D starting this year. That was a meaningful change. But the Elder Care Bill goes further. The new bill would expand the list of drugs subject to Medicare price negotiation. Right now, Medicare can negotiate prices on a limited number of drugs. This bill would accelerate that timeline and expand the list significantly. The Congressional Budget Office estimates this could save Medicare beneficiaries hundreds of dollars per year on certain high-cost medications, especially for common conditions like diabetes, heart disease, and arthritis. But here's what you actually need to do with this information. Every year during Medicare's open enrollment period, which runs from October 15th to December 7th, you have the chance to review and change your Part D drug plan. Most seniors don't do this. They stay on the same plan year after year, even as drug prices change and formularies, the list of covered drugs, get updated. I'm telling you right now, if you haven't compared your Part D plan options in the last year, you are almost certainly leaving money on the table. The Medicare Plan Finder at Medicare.gov is free to use, and it can show you exactly how much different plans would cost you based on the specific drugs you take. Use it every single year. Let's also touch briefly on Social Security's solvency issue, because this comes up constantly and there's a lot of misinformation out there. The Social Security Trust Fund is currently projected to be depleted by the mid-2030s if no changes are made. That sounds terrifying, but here's the reality. Even if the trust fund is depleted, Social Security would not go to zero. It would pay out roughly 77 to 80% of scheduled benefits from ongoing payroll tax revenue. That's still a significant cut, but it's not the total collapse you might have heard about. The Elder Care Bill does not fully solve this long-term solvency issue. That would require a much bigger legislative battle. But it does include provisions to modestly increase revenue into the Social Security system and delay the projected depletion date. Experts say by several years. More importantly, this bill signals that Congress is paying attention, and that political pressure from seniors, from people like you, is working. Here's something I want you to really hear. Social Security is not a government handout. You paid into this system your entire working life. You earned every dollar of your benefit, and you have every right to demand that it be protected, expanded, and managed responsibly. Don't ever let anyone make you feel otherwise. So what should you actually do right now, today, based on everything we've covered? Here's the thing about legislation. It creates windows of opportunity, and those windows open and close fast. The people who benefit most from new laws are not the ones who wait and see. They're the ones who stay informed, who review their coverage regularly, who know their rights, and who take action before the deadlines hit. So right now, today, I want you to do a few things. Go to Medicare.gov and use the Plan Finder to compare your current coverage, especially your Part D drug plan. If you haven't done this recently, the savings could be real and significant. If you or a loved one may need nursing home or assisted living care in the near future, start researching facilities now using Medicare's Nursing Home Compare tool. Don't wait for a crisis. If you've had a Medicare claim denied in the past year, check your appeal deadline. You may still have time to fight it. And if you're not sure whether you qualify for extra help programs, things like the low-income subsidy for prescription drugs or the Medicare savings programs that help pay your Part B premium, go to SSA.gov or call 1-800-MEDICARE. Millions of people qualify for these programs and don't even know it. Now, the Elder Care Bill still has steps to complete before it becomes law, but the momentum is real. The bipartisan support is real, and the provisions we discussed today expanded Medicare benefits for hearing, dental, and vision, stronger nursing home standards, elder financial abuse protections, drug pricing reforms, and Social Security formula improvements. These are real proposals that have a genuine chance of affecting your life. Your job between now and then is to stay informed, to not get caught off guard, to not be the person who finds out 6 months too late that there was a program they qualified for and missed. I want you to share this video with someone you care about. A spouse, a sibling, a friend from church or from the neighborhood who you know is on Medicare and trying to figure out how to make ends meet. They need to hear this too. And the more people who are informed, the more pressure there is on lawmakers to actually follow through on what they've promised. Because here's the truth about Washington. Politicians respond to pressure. They respond to phone calls and letters and emails. They respond to voters who show up informed and ready to hold them accountable. You are not powerless in this. You have more influence than you might think. And one more thing before I let you go. The changes in this bill, the expanded Medicare benefits, the new elder care protections, the financial abuse safeguards, none of them matter if you don't know about them. That's why this channel exists. That's why I spend time every week breaking down complicated legislation into plain, simple language that you can actually use. If you found this helpful, please hit that subscribe button right now if you haven't already. Because we are going to continue covering every update to this bill as it moves through the House, as the President signs it or negotiates changes, and as the implementation dates get set. You don't want to be catching up on this 3 months from now. You want to be ahead of it. The seniors who thrive in the years ahead won't just be the ones with the best financial plans, they'll be the ones who stayed informed, who asked questions, who understood their rights, who didn't let complicated government language intimidate them into doing nothing. That's who you are, and that's why you're here. Stay sharp, stay informed, and we'll see you in the next one.